Let's see about stroke today. Stroke is an acute neurological deficit occurring due to vascular pathology in the form of infarction or hemorrhage. We have another term, transient ischemic attack, which is a focal neurological deficit which starts to resolve within 1 hour and completely resolves within 24 hours. We have ABCD to score to predict the risk of transient ischemic attack going into stroke. The causes of stroke, most important causes, ischemic causes, which could be thrombotic. Thrombotic is usually evolving in nature. The stroke increases in nature over 48 to 72 hours. Then we can have embolic stroke, which is hyperacute in presentation, and we can have small vessel disease like Lacuna stroke, which is due to hypertension causing lipohydrosis of small vessels of size 30 to 300 micrometer. Then we can have hemorrhagic stroke, which could be a non-traumatic subarachnoid hemorrhage due to aneurysm, or intracerebral hemorrhage, which could be due to hypertension most commonly. Other causes include vasculitis, cerebral venous thrombosis, carotid dissection. The pain pathology is various causes. Secondary reason for secondary hemorrhagic damage is decreasing in ATP, causing failure of sodium potassium ATPase pump, glutamate release and calcium release, causing liquefacting necrosis of the brain tissue. Investigation, the first after the basic routine blood investigation, we should do CT brain to rule out the hemorrhage. If infarct, it takes about 48 hours to show up. Early features of infarct include hyperdense MCA sign, obscuration of the lentiform nucleus, insular ribbon sign, which is the loss of gray-white interface, wedge-shaped hypointensity mass, which takes about 1 week to develop. Encephalomalacia is seen after months to years of the stroke. Goals of management here is recanalize and reperfuse, and to optimize the collaterals and to prevent secondary brain damage. So thrombolysis is indicated within 4.5 hours, which is a golden period following the stroke, and CT showing no bleed. And we use tissue recombinant plasminogen activator like Altiplase, which is given at a dose of 0.9 mg per kg, 10% bolus and 90% infusion over the 1 hour. Contraindications: age less than 18 and the BP more than 185 110 millimeters of mercury, platelet count less than 1 lakh, and previous stroke in 3 months. We have supportive management, and BP should be corrected if it is more than 220 by 110 only. If thrombolysis, we have a cutoff of 185 110, and other